Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Okay, listeners, it's Lindsay Smith-Rogers, and you know what we're talking about today, explosive diarrhea. You knew we had to do an episode on this. Thankfully, we have Dr. David Acheson, who's the former Associate Commissioner for Foods at the U.S. Food and Drug Administration, and he's here to answer questions from Dr. Josh Sharfstein about the current cyclospora outbreak and the importance of the public health response. Let's listen.
Dr. David Acheson, it is great to see you. Thanks so much for coming onto Public Health on Call. How are you today?
I'm doing really well. No, thank you for inviting me. Appreciate it.
Now, we go way back to when we were working at the Food and Drug Administration together, but I'd love for you to introduce yourself and your work on food safety to our audience.
Oh, happy to do that. Yeah, I've been working on various aspects of food safety for decades. I don't even want to tell you how long, Josh, it's because it'll age me. But it goes back to when I started my career, actually, as an infectious disease physician. So I got into foodborne illness, actually treating patients with the illnesses, which then evolved into trying to understand better how bugs that you consume make you sick and what's going on, frankly, at a molecular level, which then evolved into a career as a regulator, which is where you and I got to know each other.
I just remember peanuts.
Peanuts and salmonella. Absolutely.
Yeah.
Yes. There were, the world of food safety gets stamped with these significant events and outbreaks that become memorable in people's minds. And, even today, we're not here to talk about E. coli, but if you mention Jack in the Box and E. coli,
Yes.
People will say, oh, yeah. I remember that. So there are seminal events in food safety history that change things, such as very large outbreaks linked to weird and wonderful parasites.
Right. So before we get there, we met at FDA on peanuts. And then what have you been doing since?
Well, I left the FDA in 2009 and launched into a consulting career. Since then, I've grown an international food safety consulting business, and we do work with food companies all over the world, and from farmers and growers right through to retailers and food service and restaurants. But the essence of what we do, Josh, is heavily focused on prevention. I mean, really, the secret to food safety is understanding how bugs behave, what they do, how to keep them out of food. However hard you try, they're fickle, and they get in, and they cause problems, and they cause illnesses. So one has to learn how to react, too.
That's right. They cause headlines. And so the headlines now are about cyclospora, parasite. Do you want to just give the basic, what is cyclospora? How does it get into food?
Sure. Well, there's lots of means by which different bacteria get into food. Some of them inherently live in animals and get into food because of animal contamination. Others, and cyclospora is one of them, they tend to be more prone to be in water. So we kind of learned that certain microbes live in different environmental habitats. And cyclospora is a parasite. And, for those like, well, what's a parasite? It's a small microbe. It has inherently different properties, which we can chat about, which makes it a bit of a challenge. It's structurally different from something like salmonella or E. coli, which are bacteria. We then have viruses, which are different yet again, which are obviously tiny things that also can get into food. But cyclospora is a parasite, and it lives in water. And it's when it's in the water, and it tends to be more prevalent in the summer. And so when that water gets onto food, and it typically, historically, with cyclospora has been some type of fresh produce of some sort or another. That's when we start to see illnesses. But cyclospora as an organism has got some interesting quirks, which make it a challenge.
I can tell the infectious disease doctor part of you is clicking in here on the quirks of cyclospora. Tell me about those.
Yeah, well, the quirks of cyclospora, first off, is because it's a parasite, it goes through various life stages of evolution. And if you get cyclospora on a piece of produce or a berry or something, then the parasite has to mature. And it takes about 2 weeks from the point at which it gets on the produce that it evolves and it actually changes its format and it becomes an infectious particle, because originally on the produce it's not. And for that to happen, you need a time gap, which is kind of unusual. If you get salmonella on a peanut, then it's immediately going to cause illness if you eat the peanut.
Right. Don't eat that peanut.
No, absolutely. If you get cyclospora on a peanut, and they don't typically pop up on peanuts, but on a piece of produce, there's a time lag where that cyclospora has to evolve and it has to change its form to actually infect a human. And that's like a 2-week window. And not only does it take time, but it needs a temperature that's conducive to that change. And that's typically between about 70 degrees Fahrenheit and 90 degrees Fahrenheit. So again, which is why it's a summer bug. And it adds complexity, Josh, which we can get into and trying to figure out what the cause is.
Let's say there's somebody in your house with explosive diarrhea. Are you at risk for catching this from them?
Interestingly, you're not. No, this is an unusual bug from that perspective too, because remember I said it has to go through this maturity process. So it really doesn't spread person to person.
The risk is if we're eating the same contaminated food.
That is true. If we're eating the same food, then yes, and you're eating these mature parasites that sounds scary, but yeah, that's what's going on. But you're not going to pass it person to person, which again is quirky. It's unusual because that's not usually what happens with a foodborne illness.
Everybody's been reading about explosive diarrhea. You get sick with cyclospora, you can get explosive diarrhea. Are there any other conditions or patient populations who are particularly susceptible to severe disease?
Well, like anything else, if you get severe diarrhea, you are going to lose fluids. If you are elderly, immune compromised, or a young child, then your ability to withstand dehydration is compromised. And there isn't much good news about explosive diarrhea. But if there is a silver lining to getting cyclospora, is if you stay hydrated, it's treatable. You can have antibiotics that will treat it. So it's worth getting a diagnosis, and then you can get on the right treatment. Keeping up with hydration is going to essentially get you through it. It won't be pleasant, but it'll get you through it. And it's not typically an organism that causes death from the parasite itself.
There certainly are some conditions where it's dangerous to be dehydrated. So those particular patients are going to be at higher risk. Okay, so we've got the basics.
Yeah.
Talk to me about your read of what's going on, because I'm reading these headlines and some of them are saying we're awash in cyclospora. Some of them are saying it's focused primarily on Michigan, that we always have some number of cases. How do you read these headlines? What do you think is going on right now?
Well, part of what you say is accurate. For quite a few years, we've seen a peak of cyclospora in the summer months, sort of May through, September is typically where it sits. You get a few hundred cases here, a few hundred cases there. What's different about this one is just the volume of cases. I mean, we aren't just a few hundred. We're in the thousands at this point that we know about. And as you well know, Josh, I mean, it's like when you have a foodborne illness, there's a lot of people who get sick and don't go and see a doctor. So when we talk about 7,000 cases that we know of,
right,
there's probably many thousands that we don't know of. They say, I probably got cyclospora, but I'm not feeling too bad. I'll just weather it through. And ultimately, it's going to go away if you're a fit, healthy adult. But that's not my advice. My advice is go get seen, get diagnosed, and get on some antibiotics so that you just recover more quickly. But what's different about this one right now is it does seem to be centered on those sort of Michigan area states. We seem to have more cases there. I was looking a little bit at the map of where these cases are, and there's only a couple hundred cases that are west of the Mississippi. They're all sort of east side of the country. Michigan does appear to be the epicenter at the moment, and that's unusual in just the sheer volume of cases. But that's kind of where we are. So at this point, if we backtrack and everybody's saying, where is it? What is it? What do I not eat? What's causing it? And that sort of gets you into this conversation about how do you figure out what causes a foodborne outbreak and what are the epidemiologists and the doctors and the public health officials doing to try to figure this out? Because they're all very busy trying to do that. And so far, I don't think we've got a smoking gun.
Right. Now, We've been reading headlines about lettuce. It looks like the Michigan Health Department is concerned about lettuce. Would that surprise you if that turns out to be the case? And what do you think the evidence is that they're relying on there?
Well, the way public health officials try to figure out what the food vehicle is, and the food vehicle is essentially what is the food that's carrying the parasite that you've eaten that makes you sick. And the approach is conceptually simple. I get sick. You're the epidemiologist, and you say to me, "Hey, David, what did you eat in the last 2 weeks?" And I'm going to say, "Geesh, I can't remember what I ate for breakfast." And you now want me to go back 2 weeks? So you start to try to put together a food history. And you do that with enough people, and you say, this particular food item is popping up on a repeated pattern, and people who get sick are consuming it much more often than people who are not getting sick. Therefore, we think it's X. We think it's lettuce. Now, it's summer. People eat a lot of lettuce. And so it becomes and we've had history of cyclospora on lettuce. And I think trying to sort that out, it's an obvious target. One in the context of this, I don't know.
I understand there have been some cutbacks in the surveillance of cyclospora recently. Do you think that might make it harder to get an answer?
No, I don't. Because those cutbacks are really related to a program called FoodNet, which is when you get a case, you report it into CDC. It doesn't change the numbers of individuals who are out there asking these questions and trying to figure out root cause. Now, public health has taken a hit, period. So, the number of epidemiologists have gone down, but I don't think those specific cuts in relation to CDC and tracking certain organisms, in this case, I don't think that's going to impact the speed with which we figure this out. But it's challenging because it's 2 weeks. It's like the incubation period for cyclospora, and for those who want me to just expand on that a bit, an incubation period is the time between when you eat the food and when you start to get sick. So the incubation period for cyclospora could be 2 days or it could be 2 weeks. So, you really are sort of saying, if you think it's lettuce, then what was the lettuce you ate over 2 weeks? One of the very first cyclospora outbreaks was linked to raspberries, actually, from Guatemala years ago. So there's lots of foods that it can get on, which reminds me, one other comment here is once it's on the food, it's very hard to wash it off. We talk about, let's wash fresh produce. And that's inherently a good thing to do. But if there's cyclospora on it, it's extremely difficult to wash it away.
So now I've got some final questions for you. First of all, let's say you're a food producer. Let's say there's a question mark. Maybe your food is contaminated with cyclospora. What is it that you can do to end this outbreak and prevent this from happening again?
Well, if you are a food producer and you've been linked, then the first thing to look at is your water sources. Water for produce is, depending where you are in the world, it might be a well, it might be surface water. Surface water is more risky than a well. So you absolutely need to look at your water source. And some of the forward-leaning produce companies know that, are checking water sources, are testing water sources, are putting in filtration systems, which you can do successfully to catch these bugs so they don't get into the produce. So that's where you're going to go first and foremost, is likely this is water. What's my water source? Is my water source contaminated? And try to follow it back that way.
If somebody is unaware that there's cyclospora in the water they're using for their vegetables, for example, is it likely to persist?
Yes, it is, because there's nothing that's going to make it go away. As we were talking about earlier, you need this warm temperature for the parasite to evolve to an infectious form between that 70 and 90. So as soon as we start to get into fall and winter, it loses its capabilities. Now, that it may still be hanging around in the water, but it isn't going to make people sick when it's too cold.
So for where we are now, it's pretty important to figure this out so we can take it out of people's mouths. What would you be doing if you were back at FDA to try to get to the bottom of this as quickly as possible?
We'd be relying heavily on the epidemiologists and the public health people. So, those are the folks who are talking to these patients. What did you eat? Trying to put that story together to see if we can find a source. It could be, given a 2-week incubation period, that the produce items, if that's what it is, that were causing the problem have gone. These products only have a couple of weeks shelf life. And it may be that even though we're seeing a lot of cases still, the root source is already out of the supply chain. That's possible. In fact, it's more than possible. It's likely, just simply because of the shelf life of product. But trying to understand where it came from is really important, because to your earlier question, you want to go back and sort of say, not only do we want to shut it down by identifying the product and either issuing a recall or public health advice, but we want to understand root cause. Is it the water? What's the water supply? And how do we control it? Because we're only in July and it's going to be hot for a while. And so we don't want another spike in August. So we need to try to find out where it came from. And that's a really important role. And to your point, if I was still at FDA running those programs, that's what I'd be focused on. Let's try to find out if there's something still in commerce, we need to identify what it is and deal with it. If it's not in commerce, let's go back to the place where it came from and make some changes there to control the risk and reduce the likelihood of something happening again.
Got it. Now, my last question is going to be what individuals should do. And you haven't given me a lot of confidence that an individual can really control their exposure. Like, I'm going to wash my hands. I might even wash the lettuce, but the parasites are going to be sticking to it. I'm really, to some extent, relying on the public health system to keep this away from me. But you tell me, what would you recommend for the individual?
Well, there's two important recommendations. One is easy. If you get diarrhea, explosive diarrhea, and you're sick, go see a doctor, get a diagnosis, and get treated. That's important. And stay hydrated. That's the easy part. In terms of what can I do to avoid it? Oh gosh, that's challenging. We all want to eat more leafy greens. We want to eat more vegetables. It's good for us, and we want to do that. So I'm not going to go on record as saying don't eat any of those things. But if you never want to get sick, then go lock yourself up and live off filtered water and vitamins. But I mean, that's facetious, stupid comment to make. But, we do trust our public health officials. We do. And more importantly, we trust the industry to do it right. And many do. They care about this. They don't want to make people sick. It's not good for business, obviously. And so they put in controls. And I know there's a lot of large produce companies that have cyclosporiasis controls in place. There's some that don't, but many do. So one's relying on the system to keep us safe, frankly.
And coming out of this, maybe those requirements could change, or those expectations for companies could change. If we learn something about the outbreak, maybe more companies will put in place cyclospora controls.
That's one of the key things of why we want to find out where it came from. That takes me back to my science roots, and true prevention is if you don't know what caused it, how did it get in the water in the first place? What can we do to control it at that level? And assuming it is in water somewhere, then you're right. And that, initially that can be voluntary changes. And then ultimately, as we both know, you can apply regulations to force changes around certain things. And it may come to that.
This is such an interesting conversation. I really appreciate your joining me. And what I've learned is, unlike E. coli, salmonella, where you can protect yourself by washing your hands and cooking your food, we still don't want it in the food, but there's a lot that you can do to prevent getting sick. In this case, with cyclospora, we really are relying on the public health system. And if that public health system is weak, it is going to be harder, slower to stop an outbreak that, at a minimum, causes a lot of discomfort.
Absolutely. We're relying on the public health system, and we're also relying on the industry to do the right thing. And many of them do, to try to reduce the likelihood of these things happening.
David Acheson, great to see you. Thanks so much for joining me on Public Health on Call.
Most welcome. Thank you for inviting me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.